space for conversation around women's health through the lens of naturopathic and Eastern medicine. I am Sandy Ross, and this is Her Earth Medicine Podcast. This podcast is multi-leveled. Episodes for patient education to graduate practitioner level. Thank you for tuning in, and I hope you gain value from this episode. Today on the Her Earth Medicine Podcast, we will be chatting with Dr. Maryam. Dr. Maryam is a specialist in fertility, working with both male and females. In 2002, she completed her doctorate program in traditional Chinese medicine at the International College of Traditional Chinese Medicine in Vancouver, Canada, and a portion of her clinical training was in mainland China. She is licensed with the CTCMA as a registered doctor of traditional Chinese medicine and a registered acupuncturist. Previous to her trainings in Chinese medicine, she was a general biologist at the University of British Columbia. Alison is a frequent guest speaker on the Breakfast Television and CBC Living in Vancouver, and she's often found in many of the magazines and newspapers over in Vancouver. Alison also has been a qualified examiner with the CTCMA of British Columbia, operating and evaluating the practical exams for both the Doctor of Traditional Chinese Medicine and Acupuncture designations. And previous to becoming a Chinese medicine doctor, she worked as a nutritional consultant advertising on diet, nutritional and herbal supplements, and sports nutrition. She's also assisted in research studies at the Vancouver General Hospital in cardiovascular and nuclear medicine research departments. So let's dive in and discuss all things fertility with Dr. Maryam. Welcome to the podcast, Dr. Maryam.
Thank you. I'm happy to be here.
Thank you so much for joining us. Would you mind telling us a little bit about yourself and how you became a TCM fertility specialist?
Sure. Well, I always sort of grew up with natural medicine. My grandmother always lived with us, so she would always treat us with different herbs and little decoctions that she would make if ever we had like a flu or a little stomach ache. She would always treat us with natural medicine, so that's what I was always used to growing up. And then when I went to university, I had an interest in sciences and biology, but I didn't know what I wanted to do with that. And going into Western medicine never really appealed to me. I have nothing against it, but it was never something that I could actually see myself doing as a profession. So as a few years went by and I was just sort of, rolling with it and going through the day-to-day, something happened in our family where my mother actually had a head injury. She fell at work and she suffered from a head injury, and she actually lost all of her memory.
Oh, wow.
We could actually do a whole podcast about this story, but to make a long story short, she had lost all her memory, and somebody suggested to her to get acupuncture to bring more blood flow to the brain, and possibly that will help for her to get her memory back sooner. So I would take her to her appointments and I would sit and watch it being performed, and I thought, my God, this is so fascinating. But I never thought of myself learning it, because this is back in the 90s. It was actually like 1997 at the time, and back then it wasn't so mainstream as it is now. So then somebody just actually suggested it to me and said, well, why don't you look into learning acupuncture and Chinese medicine yourself? And it's so funny because at the time I opened up the yellow pages and I found a Chinese medicine college, which was literally located on the same street as the street I lived on.
Oh, wow.
And I went to the school, and as soon as I talked to the director and I found out more information, I could completely see myself doing it. I always had an interest in working in the health field and working one-on-one with patients. And it just kind of came together, and within a month I was attending school there.
Oh, wow. Very serendipitous. And how many years have you been a practitioner for?
For 18 years now.
Wow. Okay.
I graduated in 2002.
Yeah, a lot would have changed in the field over those years too, I'm sure. So you've seen quite a bit happen through the progression of Chinese medicine.
Oh, definitely. Yeah, because when I first started practicing, it was mostly, people were coming in for a lot of pain-related conditions because that's what they knew acupuncture was helpful for.
Yeah.
And I found myself having to educate every patient that came in and, telling them, actually, acupuncture can help regulate your menstrual cycle. It can help improve your digestion. It relaxes you, calms your stress. Whereas, now when people come in to see me, they're so informed. They either have tried it before or they know somebody else that swears by it already. I mean, people know so much. So it kind of takes that, having to educate everyone that walks through the door. It takes that away. So it's really changed a lot.
Yeah, it's become very mainstream here, and especially with the younger generation, the millennials, they're very into it all, which is great because it's, it was a lot of pressure on us as practitioners back in the day to educate people, what is a naturopath, what is acupuncture. So I love that, and I think we can probably thank social media a little bit for that.
That's so true.
Well, what kind of practitioner are you primarily? Are you acupuncturist, herbalist? Do you integrate them both?
So I do both. In my practice, I do probably mostly acupuncture, but a lot of my patients I do give customized Chinese herbs for. And then, of course, I give them nutritional recommendations and lifestyle recommendations.
Okay, and classical acupuncture, or do you do 5-element acupuncture, any particular style?
Just traditional, traditional Chinese medicine.
Okay, love it. Okay, let's dive straight in. So today we're going to be chatting about fertility from a Chinese medicine perspective. So would you like to tell us what is fertility in traditional Chinese medicine?
Well, I always tell people that fertility is not just conceiving a child. Fertility is of course conceiving a child, but also having a healthy pregnancy and having a healthy baby in the end. That's true fertility. Fertility is about improving the environment for an embryo to grow and to thrive.
Okay, great. And so what are some of the common things you're seeing in clinic day in, day out that are disrupting people's cycles and leading to fertility disorders?
I think the biggest thing I'm seeing is unexplained infertility. So people have come in and said, we've been trying for over 2 years. All the blood work is normal. The sperm analysis is normal, and we don't understand why we're not getting pregnant, having regular cycles. So they're coming in, almost wanting a diagnosis of what is going on. So that's a really frustrating diagnosis to have. So I'm seeing a lot of that. I'm seeing a lot of people coming in with just so much pressure on themselves. They're going through a lot of stress and anxiety. And right now with COVID, it's just unprecedented. I have not seen this many patients with this amount of stress. I'm seeing a lot of people that are going into premature menopause. So even like at age 39, 40, their cycles are becoming very irregular. And according to the charting that they're doing, they're not ovulating. So that's a really difficult one that I'm seeing. I see a lot of PCOS patients. I see quite a bit of endometriosis as well.
Okay. Interesting you say that about the perimenopause, because I've definitely noticed an increase in early perimenopause here in Australia on the Gold Coast. And I mean, we look at it from, like you're saying, anovulatory cycles, not making progesterone. It's really stress is the driver to it. So it's interesting that, it's correlated, I guess, worldwide. If you're seeing it there in Canada, in British Columbia, Vancouver, yes? Is that where you are?
Yes.
Vancouver, yeah.
Yes, that's where I am, yeah.
Yeah, so, I mean, I wonder what's going to be the impact from the COVID stress year of 2020 on the fertility outlook of 2021.
Yeah, I mean, there's already just going through the fertility journey is one of the most stressful things I think that a couple would ever go through. So that doesn't help with all of the stress that they already have, whether it be stress with work, stress with not having work at this time, or family pressures. The list goes on and on. So yeah, I do find that is a real big obstacle to good fertility.
And that's been one of the things that I've noticed since working with fertility over the years is they are very stressed. The woman especially is stressed. The man feels the pressure of the woman as well. And that's what I found acupuncture to be the best thing for, because to summarize acupuncture, sometimes I think it's an enforced meditation for the patient. It's time out for them. We're encouraging chi flow, blood flow, and yes, we're doing the points and stuff like that, but we are actually putting them on the table. We're making them chill out. We're giving them a bit of comfort with some heat lamps, and it's like a meditation for them. So it's, resetting that nervous system that's constantly wired and on to be able to switch off and relax, which we know helps to produce progesterone. So something I think goes hand in hand. Do you work a lot with natural cycles, or are you doing IVF, fertility assisted cycles, both?
I do. I do IVF support as well. I do both the natural cycles and IVF.
Okay.
Some people come in sort of right away. They're in an IVF cycle. And others are sort of preparing for an IVF cycle that they have scheduled, sort of in a few months.
So what would be the ideal time frame if you had a patient coming to see you for fertility? When would you like to see them? They haven't started yet, so you've got the opportunity to educate them. When's the ideal timing to start seeing a practitioner?
So you mean before an IVF cycle?
Yeah, so say they're looking at doing IVF. When would you like to see them?
Right. Definitely at least 3 months prior to starting their cycle.
Yeah.
But even better, 6 months. It all depends. Everyone's different. It depends on their age, their health, the health of their partner. It really depends. But I do like that 3-month time because we can work on their egg quality.
Yes.
Because as many people know, it takes about 100 days for follicles to mature and develop. So the environment of the follicles 3 months prior to actual ovulation is very, very important. And there's so much that Chinese medicine can do to improve the egg quality. And then for the male partner, to also improve the sperm quality during that time. So, the ideal is to see both the male and female. Of course, I'm seeing more females, but I do, definitely educate them on male fertility. And, even if there isn't like an actual issue with their sperm, for them to come in and we sort of talk about their diet, we talk about what supplements they're on, their stress levels, see if they could benefit from acupuncture. And of course, probably me and you both agree that everyone can benefit from acupuncture. So that's the ideal. But unfortunately, time is not on everyone's side. So they do tend to come in like already they're on their birth control pill and they're like almost ready for the fertility injections and they want acupuncture to help them.
Yeah, yes, I agree. See a big mix. And often I found I practiced in Bangkok in Thailand for a few years and I seen the men over there, they would come in, but here in Australia, I don't see the men. I give them herbs and I don't get them in the clinic as much, although I'm also working a lot less here in Australia. But what's some of the age groups that you see for what age are people starting to come in with fertility disorders in Canada?
Well, I I mean, it's been so many years, so I've sort of seen all ages. I've even seen women in their 20s coming in with fertility issues. But typically, I'd say mid-30s and up.
Okay, that's interesting.
Yeah.
So in Bangkok, I noticed mid-30s and up was the primary age group I was working with. And then when I came back to the Gold Coast, I'm seeing women in their late 20s, early 30s mostly. So it's interesting. I just thought
really?
Yeah, yep. Anywho, I just wanted to ask that question because I'm always interested to see kind of what's the age that people are trying to conceive at. All right, shall we dive in? Let's talk about some common Chinese medicine pathophysiology in relation to fertility disorders. So this might be good for a patient to listen to just hear some of the terminology we use in Chinese medicine, but I'd love for you to dive in, if we have students listening to this podcast, to really give your insight as to some of the common Chinese medicine diagnoses that we're treating for fertility disorders in clinic.
I can almost guarantee when I see a fertility patient is booked in my schedule, I can almost guarantee that they're coming in with some degree of liver and spleen disharmony, with an underlying kidney deficiency. And I say that because of stress. Because particularly of unfulfilled desires. In Chinese medicine, we know that unfulfilled desires causes liver qi stagnation. And other emotions like frustration, anxiety, tension, anger, resentment. And once the liver is stagnant, it right away will, in essence, it'll bully or attack the spleen. And then the spleen becomes weak. And, we know in Chinese medicine, in adults, blame the liver. So there's always some component of liver qi stagnation. Now, whether it be the first organ I treat or not, that sort of depends on the whole picture, of course. But that would be sort of my, one of the top patterns I treat. And, as far as some of the symptoms of liver qi stagnation attacking the spleen would be things like feeling a lot of tension in your body, or having neck and upper back jaw pain, having some digestive problems like an irritable bowel syndrome type of thing where they get nervous and right away they have to run to the washroom. More severe PMS signs or bloating. So those would be sort of that liver and spleen disharmony. And then of course we know also that when the spleen is weak, that will affect the kidney organ system. So that would be number one. And then as far as another pattern that I see very often would be kidney yin deficiency. So as we age, our yin becomes more deficient. Yin is what keeps us young. So as we age, particularly I would say after age 35, 40, the kidney yin becomes depleted. So you can see some signs like feeling really restless or agitated, feeling hot at night, or having really restless sleeps. And I'm seeing a lot of this in clinic right now. People cannot sleep well. A kidney yin deficient person can tend to be thin, but not necessarily. And their skin tends to age a little bit quicker than average as well. So it's really that yin that nourishes the follicles, that nourishes the uterine lining. So it's so important to fertility. And it also, the yin is responsible for the egg white cervical mucus at mid-cycle, which again we need for best fertility. And then probably the third one would be blood deficiency. So again, blood is needed to nourish the uterine lining. Blood is a part of the yin. And just to make the uterus a nutrient-rich place for the embryo to be able to grow and thrive. Blood is needed to nourish the developing follicles. And when I see a woman with blood deficiency, they tend to be a bit pale. They may suffer from loss of hair or brittle nails. They may have really light periods. You know, their periods might not even last 3 days. And, you know, after talking to them and telling them what a normal fertile cycle should look like, they're quite surprised that they never knew that their cycles were actually too light. So that's sort of a big sign of the blood deficiency. Yeah, and you know, not to generalize, but I do see many vegetarian and vegan patients having some element of blood deficiency. So really a very nourishing, blood-nourishing diet is really important for that pattern.
I'll generalize. I see it a lot because I think they need to hear it straightforward. If you are trying to conceive, it is very difficult to build blood if you're a vegan. Vegetarian's a little bit better because if they're having the egg or potentially fish, that's great. But it is a lot harder from a vegan perspective. And you just can't build the blood as quick as possible. It's kind of taboo in Chinese medicine to be a vegetarian if you're trying to conceive and throughout pregnancy and breastfeeding.
Yes.
So,
and to be honest, like I've had many vegetarians, actually not necessarily vegetarian, like really dedicated vegans. And you know, I'll tell them like, please start eating meat. I know that it might be really gross for you at first because, you know, they're after not eating meat for so long, it's tough. But they want their baby, so they're willing to do everything. And I've had women get pregnant just from changing their diet.
Yeah.
So it's incredible.
Definitely. When I was in Bangkok, I seen a lot of lovely Indian clients over there that were vegetarian, strict vegetarian, although they have cow's milk in their diet, so they got a little bit of the B12 that way. However, they were not having egg even in their diet, and so, you know, there was a lot of blood building herbs and acupuncture to try and do what we can. But, you know, it's sometimes we have to work with cultures and their religion, and that's totally fine. But yeah, and I do remember one patient that she was open to doing bone broth, and she ended up conceiving quite quickly. And you just notice the difference in the timing of, you know, when do you want to have this? What kind of ethical barriers are we up against, and where can we move forward? So I think, you know, if you can educate the patient, they're sometimes open to trying things out.
Yeah, I recently had, in the last few months, I had a patient come in for fertility, and she was a strict vegetarian, and she would get her periods every 45 days. And so we talked a lot about her diet, and she agreed, okay, I'm going to start eating meat. And she went full force, and she was eating steak, and she was making bone broth, and she was so dedicated. And she literally had a 28-day cycle after that.
Wow.
And she was just floored because her cycles have always been really delayed.
Yeah, right. So maybe let's digress and go into that a little bit, because from a Chinese dietetic perspective, obviously like a steak is probably something we wouldn't give to someone that's like potentially blood or spleen deficient, but the bone broth and all those kind of foods are. So can we maybe just chat a little bit about what kind of dietary recommendations would you be recommending for someone that's maybe transitioning from maybe a raw kind of vegan-y diet into eating more meat, dairy, that sort of thing in their diet?
I mean, to be honest, I don't have a problem with steak. And I think it's just about moderation, right? And that's really the whole philosophy of Chinese medicine. So, okay, so don't have a steak every single day, you know, lunch and dinner. And, you know, have it, for example, have more soups, have, you know, bone marrow, have chicken soups and that, because they are easier to digest.
Yeah.
But if you're having a small amount of steak, I have no issues with that. So yeah, I wouldn't slap any wrists for that.
No, I wouldn't slap either, but I have found in the past that if you've gone from having no meat to eating something like a steak, it can just cause digestive problems. So I kind of transition them a little bit slower with like more the warm, slow cooked sort of meats, or maybe given some enzyme support and whatnot. But Yeah, I think everyone's individual with that. We have to take in their individual case and what their digestion functions like. I see a lot of gut stuff though as a naturopath, so I feel like I attract the weak digestive cases.
You know, I think you nailed it with just how important digestion is. You know, if our spleen is not working optimally, because the spleen produces blood, we're not going to have enough blood to nourish our reproductive organs. So really the digestion is so important, and it's really the center of everything. So I agree that they should be having really easy to digest foods. And across the board, I tell people to try to have more warm cooked foods as opposed to cold raw. So I generally say, you know, have about 80% of your diet at least be warm cooked foods.
Yeah.
So soups, stews, broths, cooked veggies, you know, rice, protein, all of that. And then maybe just 20%. And when it comes to fertility, I would even go further and say, okay, for a while, just please try to have only warm cooked food.
Yeah.
And it's really, you know, it's a shift, because I don't know how it is in Australia, but here people this is what I commonly see. They'll start their day with their big smoothie, right? With like frozen berries, and, you know, milk and protein powder. And then they'll have a big salad for lunch and a big salad for dinner, or sushi.
Exactly the same here.
Huge.
Yes.
Sushi is a big deal here in Vancouver. Yeah, so, you know, and their little treat for themselves at the end of the night is like a bowl of ice cream. So it's just so much cold. And then in Chinese medicine, that cold is constricting, and it's going to contribute to blood stagnation. So that's a big obstacle to fertility as well.
Yeah. Something I've been teaching for the past 4 years is Chinese dietetics. So I'm a bit of a Nazi when it comes to coldness and fertility and stuff like that. But I can imagine it would impact fertility so much more in Canada in the winter, because, you know, here it's cold in the winter, but it's not like Canada. So that really would make a huge difference to someone's ability to make the blood by shifting those foods in their diet. Totally.
Absolutely, yes.
Yeah. Can we maybe go into, say the student practitioners or practitioners are listening to some of your treatment recommendations, durations, whether it be acupuncture, moxa, herbal, maybe going back to the liver invading spleen. What is some of the things you're using to support someone with the liver invading spleen picture? Because, yeah, it's a common one. It's a very common one.
So with the liver invading the spleen for fertility, I always would add some kidney tonics. Like I would, let's say, give them a Xiao San or a Xiao Chai Hu Tang. And then I would add some kidney tonics. So, for example, Tu Si Zi or Ba Ji Tian or Du Zhong. So I would always at the same time support the kidneys too. For the acupuncture, I love liver 3. I love it. Not all the patients love it because it is a sensitive point, but I love that one. I love liver 14. Spleen 6 is like across the board. All of my fertility patients will get spleen 6. And I often use spleen 4. So, you know, as far as their lifestyle goes, I'll talk to them a lot about stress reduction. I'll talk to them about, you know, incorporating some kind of meditative practice into their lives, like whether it be yoga or just, you know, going for walks every day, moving their body every day. It's so important for liver qi stagnation. And to not overdo it at the same time. And again, talking to them about the warm cooked foods, because we have that element of spleen deficiency there as well.
Yeah, okay. And how long are you using your herbal treatments for before you're modifying the formulas? Do you do like a 2-week mix up, 1 week?
I like to just do the 1 week.
Okay. All right. So you're busy mixing herbs all the time.
Yeah, it depends on their schedule, but I do like to, like, if it's the first week, I like to see them about 7 days later. And just timing of treatments is important. So I kind of give them a break during their period. I just tell them, this is a time for you to just stay warm, rest, be cozy, not be sort of running around to different appointments.
I love that.
Yeah, and then after their period, I like to see them during the follicular phase to have acupuncture to bring more blood flow to the ovaries to help with the egg quality. And then, of course, having 1 or even 2 sessions during their fertile window, so around ovulation, is really helpful for just promoting ovulation and having ovulation to be as on time as possible. And if they're having a lot of liver chi stagnation, then having that treatment 1 week prior to their period. And, if they're having the fertility treatments, then of course it'll be sort of just that luteal phase where, it may be the implantation phase. So of course, during that time, I would stay away from certain points because they're trying to get pregnant. So I would, let's say, stay away from spleen 6, or I would stay away from gallbladder 21. That's another point that I actually really love for liver chi stagnation, because these women are just so wound up. Their shoulders are up to their ears. I'm like that myself.
Yeah, as I straighten my body. Okay, great. And what about someone with a blood deficiency, I should say, for the patients listening? What are some of the acupuncture and herbal recommendations you like to utilize in your clinic?
Yeah, so for blood deficiency, number 1 is the herbs. They really have to be on a Chinese herbal formula because it is, in my opinion, it's a lot more effective than just having acupuncture by itself.
I 100% agree.
So, and the great thing with acupuncture is that it moves the chi, it gets rid of blood stagnation. It's great for excessive disorders, but for underlying deficiencies, especially blood deficiency, you're going to have to come practically live in my clinic and get so many treatments for it to really do what the herbs would do. So with blood deficiency, again, it would always be modified according to their particular pattern to, just everything about them. But I would give like a modified, let's say, Bajin tongue or a modified Hui tongue. For the acupuncture, again, I would do spleen 6, but stomach 36 is super important for nourishing the chi in the blood. What else would I do? I would do a spleen 4 again. So of course it really just depends. And it also depends where they are in their cycle. If they've just finished their period, I would add on a kidney 3 to nourish the yin. So
yeah, okay, great. And what was the other pathophysiology, the kidney yin deficiency?
Kidney yin deficiency. So for kidney yin deficiency, I love doing Liu Hui Di Huang Wan.
So do I.
But I like adding some Dongui, Bai Shao, particularly in their follicular phase. After they've had their period, we want to really replenish that blood and yin. And of course, I would add some more kidney tonics. So again, like Tu Suzi to get them geared up for the yang phase of their cycle, the luteal phase. I would add on some Nu Zhenzi, Han Lian Sao. Those are great for kidney yin deficiency. So I go through so many bottles of Liu Hui Di Huang Wan in my clinic, for sure.
Yeah, it's so effective. And acupuncture?
Acupuncture, kidney 3 is my favorite for kidney yin deficiency. I often add on kidney 6 or kidney 7. I tend to not do all 3 of them because that's a bit of a sensitive area for people, just around the ankles, particularly if they're quite thin. So I would add on, let's say, a kidney 6 to also supplement the yang, because when you're nourishing the yin, you also have to keep in mind nourishing the yang at the same time. I would do definitely Ren 4, Ren 6. I would do stomach 27. That's great for kidney Jing. And by the way, I do Ren 4 and Ren 6 for almost everybody too. Those are just my favorite points, to just bring more blood to those reproductive organs.
Yeah, I think most fertility acupuncturists would definitely be utilising those points in almost every treatment.
Yeah, and I have to say too that the TDP heat lamps are like a godsend. So I have 2 in each treatment room, so I always put one on their feet and one on their lower abdomen, and patients just love them. They keep asking me if they could buy one. So, yeah.
Yeah, no.
I don't do a whole lot of Moxa in the clinic just because I don't have the time.
Yeah.
The smoke isn't really an issue because I actually work out of my home office, so I can really do whatever I want in here. But yeah, the heat lamps are great.
Yeah, I found giving little sticks to go home with and just giving them a few basic points really effective for when we don't have the time in the clinic, because I know exactly how it can be.
Yeah, and I have to say too, like with the fertility patients, they love to be told what to do at home. Like they just soak it all in, and they're really such good patients. Like they will do what you.
They're very dedicated.
To do.
Yeah. Excuse me. Okay, great. So thanks for chatting about some of those common pathophysiologies, because I think they're very common ones we see here as well. Definitely the spleen is something I'm always looking at in patients, and blood, and obviously their own individual pathophysiology comes into it, you know, with heat and cold and whatnot as well. Can we maybe move into, are you working a little bit with high-risk pregnancies such as reoccurring miscarriages and, okay.
Yeah.
Can we chat a little bit about potentially supporting patients with reoccurring miscarriages?
Sure. So with recurring miscarriages, it's actually quite surprising how common it actually is. I think that women just don't necessarily talk about it. But for someone who, let's say, has had miscarriages in the past, and then they get pregnant after seeing me, I like to continue our treatments with each other for at least the first trimester, and that'll just to help hold the chi and prevent any miscarriage from happening. So with recurrent miscarriages, of course, like first organ that I would look to is the kidneys, particularly kidney Jing, and then a balance of kidney yin and yang is really important. Definitely women that are, women that get pregnant a little bit later in life, like in their 40s, it's really a testament to how strong their kidney Jing is. So kidney Jing is a really important thing to look at, particularly once you start having like over 3 miscarriages. It's particularly important. Also, qi deficiency is important. So if I do see an element of qi deficiency, I may give them like a modified Buzhong Yi Qi Tang. I really love that formula. Sometimes there's blood stagnation involved, particularly, let's say, if they have a history of endometriosis. So that's another thing that I like to work on. And of course, I don't put too much pressure on them, but I do tell them, can we work together for a period of time without you trying to get pregnant, just for your body to heal and to get ready for the next pregnancy. So they don't always have the time or want to take that time, but that's a good, key to, especially removing the blood stagnation, because if you want to do that in a very strong way, you have to be so careful when they're trying to get pregnant and not using the wrong herbs and whatnot. Yeah.
And so what are you doing in the first trimester in terms of acupuncture?
I do a really gentle treatment usually, like once they're in their first trimester. I definitely always do 20, which holds and lifts the chi. That's my favorite point, and I should have actually said that 20 is a point that I do on a lot of my fertility patients.
Yeah.
I like using stomach 36, but with really gentle stimulation because it can be a little bit moving, but it's great for sort of nourishing that chi and blood. So that's a great one. I like pericardium 6 as well. I feel like that's a really settling point.
Great for the nausea too, associated in that first trimester. And so let's say they're 12 weeks, they're on the all clear. What's the frequency of treatment, and are you keeping them on their herbs?
So I don't always have them on herbs once they are pregnant. It really depends on their comfort level. But after their 12 weeks, I just sort of see, okay, are they having any pregnancy symptoms? Are they having, for example, pregnancy back pain or heartburn or morning sickness? Because sometimes the morning sickness really can last like way past the first trimester. So I tell them, come and see me so we can treat these pregnancy symptoms. But generally the second trimester, they see me, if nothing is really coming up as a symptom for them or discomfort, they can see me about once every few weeks or so, not very often. But then in their third trimester, I do like to do a lot of pre-birth treatments and just getting them ready for their postpartum, for better postpartum recovery, preventing any postpartum depression, and just getting them ready for an efficient birth. So so that's another treatment that I do. But generally speaking, I don't always have patients on herbs during pregnancy.
It's a lot harder to get someone to take herbs when they're pregnant because the tolerance for the taste is gone. Yeah,
exactly.
Especially if they've got hyperemesis, then herbs are very difficult to digest. They won't hold them down. And I love doing I call it a ripening phase, sort of, from the 36-week mark in the building up for the labor and the postnatal. Do you do any treatments after they've had the baby? Are you a big one on the confinement period, or do you do anything specific in the postnatal period for your patients?
So I love giving them Shenhua Tang. I don't know if you're familiar with that formula. Yeah. It's so great for postpartum recovery.
Yep.
It's like it gets rid of blood stagnation. It nourishes the blood. It's just a beautiful formula. So I always suggest it to the patients. And if they're not sort of willing, let's say, I just tell them, you know what, have your baby, rest. They're usually not necessarily so willing to come to appointments, but after about a month, they're a little bit more mobile, especially if they haven't had a C-section. And they can come in if anything comes up, but it's not a time that I'm seeing a ton of patients. Like, I don't see a ton of postpartum unless something is happening, like insufficient lactation. Then
colic.
They'll be quite they'll be quite wanting to see me, because insufficient lactation can be acupuncture is great for that, because there's oftentimes a lot of like liver qi stagnation, and the acupuncture works really well.
And I love herbs for lactation as well, because I found personally they worked for myself. And I'm a big believer in encouraging women to take their herbs in that postnatal period after the blood loss, because I think they don't need to come in for treatments. They need to just stay home and confine and rest as much as possible, keep warm, learn how to breastfeed and do all the things with the new bub, but take your herbs if you can. I think it's really important.
Definitely.
Okay, can we chat perhaps a little bit about the lining in women and some of the things that you like to do to support healthy lining in patients?
Yeah, I think particularly those that are going through IVF, they may have been actually told that their uterine lining is thin. But if they haven't, there are certain clues in Chinese medicine that will point to them probably having a thinner uterine lining. So when we talked about blood deficiency before, like, for example, having very light periods, or their periods are not lasting for, more than a day and a half to 2 days. or having delayed cycles perhaps, and then some of the blood and yin deficiency symptoms. So again, going back to, are they dizzy? Are they suffering from thin or loss of hair? Those kinds of like dry symptoms, dry skin, that will point to them having that blood deficiency. So, and at the same time, it could also be an element of blood stagnation. So I find if I do give a Chinese herbal formula, I'll add a few little, blood movers in there, like some chuan sheng or some dan shen, maybe some tao ren, but very gentle, like small doses. I find that really helps. And I really encourage them to have blood nourishing foods in their diet. So bone broth, like I can't say enough about bone broth, cooked greens, foods that have a lot of iron content, like almonds, spinach, red meat is great. And then moxa is a really good thing to do for nourishing the uterine lining. So just like you, I give them their moxa sticks to take home. I either send them videos to like how-to tutorials.
That's a great idea.
Yeah.
I'm going to use that. I have a little piece of paper I give out.
Yeah, exactly. And I mean, they love it because it's like, oh, I can lie down. It gives me an excuse to lie down for like 10 minutes and just do some moxa. So I'll teach them to do it on their lower abdomen, like around Ren 4 or Ren 6. I'll teach them to do it on spleen 6 or stomach 36. Those are great points. And it's actually amazing how well it works.
Yeah, and I think because obviously with time and not being able to treat like they do in China, 3 times a week in the hospitals, giving them the little bit of homework really helps encourage the time between treatments that patients can come in.
Mm-hmm.
So I love that,
I think with Chinese herbal medicine, focusing like during their period to give them a formula that allows that old stagnant blood to be released in order to generate fresh new blood. So giving them something like a Tao Hong Su Tang just during the days of their period. And then after their period's over, I like to give them like a yin and blood tonic, like let's say a Liu Hui Di Huang Wan plus Dong Hui plus Bai Shao, some kidney tonics to replenish that blood that's been lost.
And that's the beauty of using granulated herbs, I think, mixing them up for your patients at the time of their cycle. One last thing I want to touch on for female fertility before we move on to males is about egg quality. Do you want to maybe run us through what the TCM view is on the egg quality and what you're using to support patients with maybe poorer egg quality?
Well, when it comes to egg quality, we look to the kidney jing because it's the strong kidney jing that really contributes to good quality eggs. And also kidney yin, because the kidney yin is needed to nourish egg development and maturation. And the kidney jing is, you could translate that as your reproductive potential. And, I've had women come to see me in the past that are in their early 30s and they're already sort of being told that their egg quality is quite low. And that points to, again, that kidney jing deficiency. It's just that their genetic predisposition to having low quality. But the great news is that Chinese medicine can do something about it. And oftentimes Western medicine might disagree with this. But again, like having that acupuncture to stimulate more blood flow to the eggs is great for egg quality. And just really having that time to work on the egg quality, having, let's say, that 3 months with the patient, let's say even like if they are going to be going the IVF route, having that time with them prior to their IVF cycle is really important. So again, with, acupuncture and herbal medicine and just talking to them about their diet and lifestyle, exercise, Yeah, so definitely there would be other patterns involved, but number one would be treat the kidney system.
And I think what you're saying about when you talked about in the beginning with your herbal formulas, you're generally using some kidney herbs in there, because most of these patients do come in with other kind of TCM pathophysiologies. Most of it could be like they look blood deficient or their spleen or liver. But then, you know, from a traditional Chinese medicine perspective, a lot of it does come back to that kidney energy. And so that's the beauty of the herbs as well, as being able to add in that additional support for the kidneys. I mean, they sometimes have the kidney in shoe signs, but not always, I find.
And the reality is that people are coming in with a lot of patterns combined into one.
Yeah.
I mean, they've got the liver spleen disharmony, they've got the blood stagnation, they've got kidney yin and yang deficiency.
Yeah.
They may have cold in the uterus. Like, it's very complex, but it's about knowing, okay, what is my priority here? What do I treat first? What are like the first two or strongest patterns in this person? That really helps me in the clinic, to not get overwhelmed and go, oh my gosh, this person has everything. What do I do first?
Yeah, I utilize my, I guess, naturopathic perspective with that a lot, and I always start with the gut. If there's something going on with the gut, we work that, we get them pooing, or we tonify the loose stools, we get the bloating gone, so that we make sure whatever we're doing, they're absorbing it, they're building their blood, they can utilize whatever's coming through the diet. And then I also support those other things. So yeah, I think it's very important to tailor, you know, the specifics of what condition do we need to look at now if there's so many patterns happening.
Definitely.
Is there anything you want to add in addition to what we've already discussed? So you've given us a great wealth of knowledge. Thank you very much. Just to sort of wrap up on the fertility for the females before we move into the male fertility, is there any take-home messages that you want to say for maybe student practitioners or even patients listening to support female fertility?
One important thing I think that patients really need to know is that there really is no such thing as infertility. To me, that's such a strong word, because Chinese medicine is so great at finding those subtle imbalances and providing those little tweaks that are needed to balance the body and improve the fertility. And it really works quite well because it's all customized to the individual. So I just want women to know that there is hope, and Chinese medicine is really effective. And combining, if they're wanting to go the IVF route, combining acupuncture, and possibly Chinese herbs with their IVF cycle can be so great. And also for the students, just to know that there really is so much that we can do for these patients. So that would sort of be my take home. And, of all the things that I think are sort of the easiest for the fertility patients, and something that could be the most powerful is what we already talked about, is to really start to incorporate more warm cooked foods. It will do wonders for their circulation, for their blood flow, and it really comes down to better blood flow, better digestion. Better digestion is going to help all the systems of their body. So if there's even just like one thing that a patient of mine can, that I want them to start to do right away, is just that.
So important. And I think it's very hard, especially like if you've seen a naturopath, because as a lecturer, I've been in both departments in the college, and in the Chinese department, we see all the naturopaths come in and they've got very deficient cycles. There's no blood, and they're all eating these kind of very enzyme-rich diets that are very healthy and super clean, very Instagrammable, let's say that. And the simple switch of really educating them around changing from the cold to the warm is so important, because it takes a long time. One of my best friends, she's a naturopath, and I studied naturopathy and Chinese medicine, so it's been years of trying to really help her to understand the energetics. And I find one thing really supportive for patients is with the energetic shift to understand that, yes, there's more enzymes, but if our body's too cold and deficient, like our fire is too deficient to be able to burn and break down those foods to actually utilize the enzymes, then the enzymes don't really have a purpose. But if we cook the food, yes, we lose some enzymes, but it's more bioavailable and our body can actually utilize what little enzymes are left, but they'll actually be utilized and also, absorb and metabolize the nutrients in the food. So it's hard. It's very hard for women to kind of go from a very cold diet to warm diet to really understand why they're doing it, but it's so effective.
Yeah, for sure. And again, like just going back to how good these fertility patients are, like they will make those changes. For a vegan patient to start eating steak, I mean, it's unheard of.
Yeah.
But if they're struggling with fertility, I mean, they want their babies so badly, and they're willing to put the work in. So, yeah, it is a real shift. Like in North American culture, as I was saying, it's just all about those smoothies and the big salads. And oh my gosh, I'm being so healthy because I'm having a salad for lunch or a salad for dinner. So I'll sort of take them like from where they're at and very gently give them some recommendations. And I'll tell them, okay, you don't have to stop eating your salad, but how about if you add a piece of cooked meat, like add a piece of fish or some chicken breast. Why don't you have a hot water or herbal tea right after you have your salad? Or, we sort of, I meet them where they're at, let's just say. Yeah, so it's not as drastic.
Yes. Well, there's some great recommendations. Thank you, Dr. Maryam. So we're actually going to move on to male fertility in the part 2 of this series. So just in case no one listens to the second part, they don't get around to the male fertility and they've just heard this part 1, where can our listeners find you?
Sure. So my website has a lot of resources, a ton of articles and lots of tips for patients. And probably TCM students would be really interested to also take a look so that they can in the future give these tips to their own patients. So my website is called ChineseMedicineClinic.com. And I'm also on Instagram. I just started this last year and a bit. But you can find me on Instagram, and I give tons of information on Instagram too.
Okay.
What's my Instagram profile? It's at drmaryam.chinesemedicine.
I'll make sure to put all your details in the show notes for our listeners to find as well.
Perfect.
Okay, so let's move on to male fertility now. Thanks for listening, guys. This is a 2-part series, so just be sure to click out and go to the next episode to listen to our conversation around male fertility. Thank you for listening. I have been a practitioner of naturopathic and Chinese medicine for over a decade. I have a master's degree of health science and I am an academic lecturer at Australia's leading natural medicine college. I am available worldwide online for bookings. Simply go to sandyrosshealth.com.